Eduardo has 15 years of experience working with Ontario's international or migrant agriculture workers and their employers, and has helped coordinate OCAO's migrant farm worker program. And he currently co-leads an OMAFRA-funded project titled Community and Workplace Psychosocial Supports for the Mental Health of International Agricultural Workers in Ontario. And he's worked with Shirley on some of this stuff, actually, and as well as a federally funded project as part of Kairos, Canada's Empowering Temporary Foreign Workers during COVID-19. Eduardo has extensive experience working with agricultural worker communities to identify information needs and occupational health and safety concerns, and towards developing accessible and effective responses and interventions. And we're so happy to have him. We've been trying to integrate Eduardo's excellent, just amazing work, realizing that occupational illness is so high in this population and such a concern, which really was evidenced by COVID. So welcome, Eduardo, and so happy to have you here.
Thank you so much for that introduction and for including me. So yeah, I'm here to share some of our work with migrant or international agricultural worker communities arriving to work here in Ontario. As you may know, these workers have been critical to agriculture in Ontario since the 1960s, and are increasingly also employed in Quebec and British Columbia, as well as some of the other provinces as well. But I'm going to be narrowing in a bit on our work with these communities during the ongoing COVID-19 pandemic, and specifically how we continue to try to better understand the information and resource needs of these communities, and how to best respond and support. So in terms of some takeaways and connecting to the theme of this webinar, really want to emphasize how integral collaboration has been for our work. We definitely have not been able to, we would not have been able to do all of this work without, the collaboration with a lot of stakeholders, including, amazing community groups that are on the ground and really make up, this incredible network of support for these communities that really ensure that when the current system, unfortunately, leaves people out or people fall through the cracks, there's, just amazing people in these rural communities there to help out. Another theme that I really want to emphasize, and it's kind of connected to last week's session that I was supposed to present on around workplace tools and knowledge mobilization, is just the importance to recognize that a one size or one way fits all approach to knowledge mobilization or OHS communication and education is not effective, and that we need to really continue to recognize the diversity across worker groups and the diversity in their communication needs, and to ensure, effective two-way knowledge sharing and understanding. And increasingly too, we're recognizing the importance of understanding cultural considerations in terms of ensuring effective communication. So just to kind of give a bit of a brief background here, some pictures of some of our activities, but our program is very, very outreach driven. So we, and this is pre-COVID, and so as I'm gonna mention, COVID has definitely changed our work, but pre-COVID, we were really focused on getting to these workers in the community, as well as the workplace level, but definitely very outreach driven. We would show up to community events, set up information tables, and just really reaching workers where they were at. So in terms of why our focus on this worker population, as we know, agriculture continues to be among the most dangerous and hazardous work. Workers are exposed to a lot of ergonomic hazards, problematic postures, prolonged postures, repetitive movement, really long hours, exposure to sun, heat, irritants, chemicals, pesticides, herbicides. And increasingly, there's also research recognizing the mental health and psychosocial hazards experienced in work within the agricultural industries. There's really important research that came out of the University of Guelph that identified concerning trends among farmers, employers working in Canadian agriculture. And there's also been research looking at similar, mental health challenges experienced by workers. And as mentioned, we're currently conducting a project that we're hoping will contribute to better understanding on that as well. And also important to recognize the socioeconomic character of these communities is very important as well. So a lot of these men and women are coming from rural real areas within their home countries, usually from regions that are economically marginalized. So this, this opportunity to work here is very vital. A lot of them, actually, some of these programs target workers that have family dependents, have large families. And so, it's definitely a situation where workers feel as though they're very limited in their opportunity to make a living back home. And so this work becomes very, very crucial to their livelihoods and that of their families. And that's very important to recognize as well in terms of their migration experience and their experience with tied work permits. So they arrive here with their status to be able to be here connected to a single employer at the moment. And so all of that really does have an impact on their ability or sometimes a hesitation to speak up, to identify health occupational health concerns, or sometimes we've talked to people who have been working with ongoing injuries or health and safety concerns due to a fear or hesitation that they might lose this opportunity to work and this important livelihood. So that's kind of an important part of our work to recognize. So this map is a bit dated, but the trends that I wanted to just touch on here are still valid. So this is kind of presents Ontario and the hotspots of agriculture within the province. So our program and our small staff have spent a lot of years traveling to these regions. So you can see, you have the Niagara with a lot of fruit, vineyards now, held in Norfolk, used to be, very large in tobacco. Now it's ginseng and a lot of vegetables as well. To then Essex, Kent, and Leamington with a lot of the concentration of greenhouses. Another trend here is the country of origin of a lot of these workers. So it's still predominantly a lot of workers coming from Mexico, as well as various countries in the Caribbean, followed by under a different program, but there's a few temporary foreign worker programs under which these workers are arriving to, but workers coming from Thailand, the Philippines, as well as some other countries in Latin America. So I guess just really quickly, the core of our program has, and a bit of the foundations of our program came from parachute occupational health clinics that we would run in the community. We've stopped running these as much due to the entrance of community health centers that are now really stepped up and are providing specialized services to these communities. But initially, when we first started, there was not much access for these workers to any type of healthcare or assessment. So we really leveraged our clinical staff. So here's some pictures of some of our physicians and nurses, and we would connect to a community group, so very collaborative, pick a location that was accessible to workers, and so included church basements, the pack of community centers. One picture here is actually a tent that we set up at a soccer tournament that was held every year. So very kind of mobile, and we would land, advertise about a week before, and it would be, invite workers to come speak to our physicians and nurses. We'd prioritize concerns that were occupational related, but we wouldn't turn anything down. There was no need for health cards. We'd have translator interpreters on hand. And really, in no way was this meant to try to suggest we could provide long-term and comprehensive healthcare for these communities. Of course not. That was way beyond our capacity, and again, not our focus in terms of occupational health and safety. But it was really we did definitely support workers directly, but it was really a great learning opportunity for us. The clinical data that we accumulated, and as I'm going to show, the numbers were not huge across the years, but it was really a way that we got to know this community, got to know, the occupational health issues that were affecting them, and also, through our clinical questionnaires, ask them about their work and get to know kind of the, the hazards that they were encountering and the work dynamics. So this also led to a lot of collaboration with primary healthcare clinics in the region, so that we wouldn't, just run a clinic and then disappear. We did a lot of referrals to the emerging system, as the local systems actually started to reach out and work with these communities. So here's some just quick data. As you can kind of, assume, or, from agricultural work, musculoskeletal issues were, quite at the top of what we saw, dermal issues, eye issues, and a range of others. But again, this was really informing what we then would prioritize in terms of prevention, education, and interventions. This data usually is similar to now what you're seeing of data coming from the primary healthcare clinics. that are seeing these patients. It's MSK is is usually at the top. So then from there, from our clinical support and findings, we developed workshops and really identified materials and tried to get information to these communities to try to prevent what we were seeing clinically. So, we took it to the community, again, mentioned community events, and we really tried hard to get onto the workplace level as well, recognizing that, being able to be at the workplace, really understanding what's going on and have, opportunity to provide recommendations, education, and also recommendations that is really integral. So it was a challenge, definitely the industry is one where, some employers were not, jumping to let anybody onto the farm and all, so it was a lot of years of building trust and to ensure we could get there. But definitely the community was the biggest space, I would say, where we would really engage with workers. We looked at a lot of materials coming from the US, and this is kind of starts to connect to my focus on information, on accessibility and information, because it was just a continuous recognition of a lot of occupational health and safety materials not being developed provincially for these communities in accessible ways. So there's a lot of, obviously, beyond just language needs among Latinx communities and Thai communities, but there's also literacy barriers among some of the other communities, including the Caribbean community. So really looking at accessible information was really important. So often took us to US materials, which from their extensive experience with agricultural workers there as well. So I'm gonna just skip this, but these are just some topics that we ended up focusing on. And I'm not going to spend too much here, but I just wanted to kind of showcase a little bit of how we would work. So pterygium, this was a condition that we saw among a lot of agricultural workers that we worked with. So it's a little flap of skin that starts growing in the eye caused by exposure to UV and constant irritation to the eye from dust, wind, and what have you. And it was very common among workers. And so we really took this to, focus on prevention education. We talked to workers about sun exposure or UV exposure and the importance of wearing safety glasses that had a good or that had UVA, UVB protection. Looking at wearing hats to, again, shield the face from light or from UV, as well as the use of eye drops to keep eyes moist. And again, this as a topic might not seem as, the most high hazard, but it really was one that workers really connected to. And it really led for us to really gain a lot of trust and make a lot of contacts within the community. So we put on a workshop. We'd actually be able to provide workers with a free pair of safety glasses, and they could choose from a variety of ones. And that way it was just and we also within this then developed some materials aligned with this subject matter. We did a bit of questionnaires and a bit more data collection around, pre-intervention and post-intervention to try to assess the impact of the safety glasses use and as well as the education. We presented this in the US at a conference there for the National Center for Farm Worker Health as well. So it just gives you a bit of an idea of how we kind of focused on a hazard. And this is kind of before COVID, this is a bit of a synopsis of our program. Again, working on focusing on some clinics, the number of clinics kind of decreased, worker education, employer outreach, specialized projects. So pesticide safety and pesticide safety concerns definitely was something we started to work on prior to COVID through identifying a lot of concern among workers around wanting more information around that, and some health forums that we put on as well. So just jumping to COVID and the pandemic, rightly so, we were quite concerned at the onset of hearing about this. Just work with these communities, we right away knew that this was going to be a challenge and was going to be a big risk for a lot of people. We had concerns around obviously work conditions, congregated housing. Workers are housed on the property of the employers. Things have changed through COVID, but initially, a lot of crowding, sharing of a lot of space among quite a few workers, quite a large number of workers. Obviously, although some work is outdoors, there's still work that had to do with coming in close contact with each other. There's, as I mentioned a bit, the information or training availability to these workers and assessment to make sure that training and hazard education is effective was not really well established. So a lot of difference in some farms doing training, others there'd be gaps, and not much assessment around that. So we were quite worried. So early on in the pandemic, we produced this paper really trying to sound the alarm around a lot of areas that we thought really needed to be really quickly addressed before before things got worse. So I can share this later on if there's interest in my slides to click on this, but that kind of was the initial jump into this. We spent some time looking at resources. So again, from our experience where other hazards were not so well, I guess, communicated to workers in accessible resources, we started looking at what was available early days around COVID education, COVID kind of awareness, or COVID-19 safety information. And we pulled together what we found really quickly, also looking at the US and Mexico, really emphasizing accessible and kind of visually based videos that could help employers, communicate key messages to workers. So we put these, simple tables together with lists of resources and try to get them out as quickly as we could to employers. We partnered with the Ministry of Labor in June of 2020 to, this already kind of was in full swing, and we, worked with the ministry to try to then get what was known at that time of the already outbreaks that had occurred during that time. What information did we know, and how could we then re-channel what was known and any kind of need for changes to try to prevent further outbreaks back to the industry and back to key stakeholders. So this was a webinar that we attempted to do that. We then focused on developing some videos to try to, again, continue to communicate what we identified as important COVID-19 safety messaging. The videos definitely don't look great. It was our first go at really, and just the timeline was very quick. We just wanted to get this information out. So, it was a lot of information, didn't look great. And now we're definitely lessons learned about needing to pull in a good videographer just to make sure products look good. But it was definitely our attempt to get some key information out. So that kind of takes us to 2021, and I know I'm already ate up a bunch of my time, but this was kind of most of the focus I wanted to get to was this project. So in continuing kind of our focus on trying to understand the information needs of these communities, we were approached initially it was the Ontario Greenhouse Growers Association, who was in talks with OMAFRA, the Ontario Ministry of Agriculture, around needing to identify resources and ensure that COVID-19 resources were accessible and effective for these communities. So later on, the project was passed over to Ontario Fruit and Vegetable Growers Association, and we then connected with them and established a partnership for this project. So the project was focused on, again, understanding and supporting the COVID-19 information needs of these workers. Again, with collaboration, we were able to hire a graduate student from the Dalai Lama School of Public Health at the University of Toronto, Mavra Kumar, did amazing work, and really, it showed the connection between public health information that was really coming out at the time and the occupational health and safety lens as well. So it was a great, coming together of that. Another really, exciting part of this project was the hiring of three positions that we called cultural community liaisons. So, the focus was to really understand the communication and resource needs from cultural perspectives. So we hired three positions focusing on the three largest cultural communities representing the workers arriving. So Latin America, there was a Latin American cultural community liaison, a Caribbean, and a Thai community. And so we hired a Swanee Kano, Camille Roberts, and an Oratai Bowers that also did amazing work. So these individuals either come from the same cultural communities as, or those three cultural communities. One actually had lived experience working under one of the programs as a international agriculture worker and has family that is working under the program as well, and just have that understanding from the perspective of culture and language. And we really ensured to not try to not make these positions tokenistic in any way. These colleagues were vital and were integrated throughout the project to really provide us their insight and really recognized what they brought to the table that was amazing work and considerations. So the first deliverable of this project was similar to what we had worked before, was a gathering of just as much resources as we could find. So again, through the leadership of Mabra Kamar, we did a large sweep of looking at categories of key information we thought was important in terms of COVID-19 safety, and then just did a sweep of US or Canadian, Ontario Canadian, US, as well as some of the sending country materials that were, we ensured that they were well sourced, but we were looking to kind of have diversity in sources, again, looking at videos, and really interested in some materials that were coming from sending countries as well, that had a bit of that cultural rooting as well. And so this library was produced and provided extensively to employers as a resource for them in preparation and for their health and safety programs as this all got started. The next part of the project that is was really important to us was worker interviews. So we really wanted to identify from workers what COVID-19 safety information that they had received the year prior, the season prior, identify any issues that they still were unclear about or would like more information about, what formats and methods they thought were the most effective to share information with them. We also specifically were interested in COVID-19 vaccine and vaccination concerns or information needs, and I'm going to touch on that really quickly. I have my timer on here that I'm going to run out of time, but I'll do it quickly. Just in terms of that being a really important issue that ended up being really important as things played out. Also looking at their cell phone use and internet availability. COVID really impacted the ability to, obviously connect these workers in person. So we had to really leverage how information could be passed on to workers. This population is one that is increasingly becoming more experienced with cell phone use and tech, but it's definitely not, at the level that now a lot of information is being shared at. We're shifting to a lot of use of apps, but this is not a community that's necessarily conducive or for that type of strategy. There's definitely some changes, but we had to really think about that through. So again, the sample size of the interviews was not large at all. We ended up being able to interview 27 workers, but we were able to get a distribution across the 3 cultural communities that we were focusing on. So we interviewed 10 workers from the Caribbean communities, 10 from the Latinx communities, 7 from the Thai community. We tried to get dispersed workers from across different regions of Ontario, agricultural regions of Ontario, and the interviews took place between late February until late March. So in terms of the questions, they were organized, loosely. The liaisons actually conducted the interviews. They were done via phone, and they were trained to, avoid leading. But again, the rigor of these interviews was difficult across 2 languages or 3 languages and different cultural experiences. We tried to really figure out how to best get to what we were looking for. But in general, we were asking, had they received information on a particular topic? Did they understand it enough, or was there something that they would want to know about that topic, which is a tricky way to ask somebody if they need something more, and assuming that they know what they don't know. But we tried to get through that through conversational styles of asking the question. And we also again asked about cell phone use and accessibility issues. So I'm going to just, again, it was a small sample, but we definitely were able to identify some gaps, some information gaps, what information people had received, as well as some perspectives around best ways to share information with themselves as well as their peers. There was a lot of data, and so here I'm just going to really quickly showcase a couple of areas that we were really interested in. So vaccine information, really quickly, and this was really a concern. So again, if you picture this happening in February to late March, and the vaccine started, these agricultural workers were prioritized in phase 2 of the vaccine rollout that was actually happening in early April. So this window was a very tight window around knowing that these communities would be offered the vaccine, but really wanting to understand what they already knew to ensure that they were making decisions based from a confident didn't have concerns about this, and that ensuring that they didn't feel like this was something being at that point, I guess forced on them, and things are, yeah. So it was just to make sure that they were supported in their decisions with proper information. So as we saw, very little information had been shared with these communities about vaccines and vaccination. And so here we were reporting, have you received information, and do you think this was enough, or was this enough? So, very glaring. And again, the numbers were, but this became something we recognized across the communities as we got to talk to more of them. We ended up asking more questions about vaccines because it became apparent that we really wanted to understand if there was any misconceptions or concerns about areas that they wanted to know more about. I'm going to share my presentation later on. We had some qualitative answering and that we captured here too. So concerns around infertility, wanting to know about, a lot of these are across so many of our communities in terms of what people were concerned about with the vaccine. So a lot of that as well. Another issue that we focused on was worker rights and responsibilities. So we really wanted to know in terms of COVID-19 and the level of confidence that was expected to a worker to, identify symptoms, report those symptoms, identify anything that they, were concerned about, any breakdowns in COVID-19 safety at the workplace. That level of confidence was one that we were worried about because of our past experience and the reality of the reluctance of a lot of workers to speak up for fear that they're in a position to have their participation be seen as a negative or as troublemakers, and that's kind of something very much felt across these communities. So we really wanted to get a sense whether workers had received information about their rights, about the responsibilities around the right to participate, and that should be something supported at the workplace level as part of the IRS. And so we kind of saw mixed data here, and so it was an area that we were also very concerned about. The qualitative kind of responses noted that a lot of people had not received training. They were not really aware of their rights or what to do if they had concerns. Again, this is really important to us because, since 2014, there's a requirement in Ontario for all workers, for employers to ensure that all workers have a basic understanding of their rights, occupational health and safety responsibilities, the role of responsibilities of the employer, supervisor, all of that as well. So in our work with these communities, we really recognize that most workers, it's changing, but a lot of workers have not received this information. The ones that have, it's just actualizing or having that confidence to really, have that become something that they feel comfortable with is a challenge. So WSIB was also something that we really picked out. A lot of workers had not received information about WSIB during the pandemic, both in terms of what would happen if they contracted COVID at the workplace and had to stop work, as well as just any type of other WSIB relate or any other injury or work-related illness and how to navigate that. So that was another area that we identified. So I'm just mental health was another one. So here the data really clearly emphasized, again, small sample, but this ended up being really seen across the communities as we did more outreach. Not a lot of knowledge around, resources available to them. And this was so crucial as a lot of, people went right into isolation, sometimes did not have connectivity to keep in touch with family back home. So during those 2-week isolation periods, there was a lot of concern for people's wellness, mental health. So that was definitely a focus. I'm just going to skip through because I know I think I have about 2 minutes in my counting. But in terms of what we did with all of this knowledge, the project itself produced quite a series of resources and videos. And here's some links, and I'll share my resources. So it's on the website of the Ontario Fruit and Vegetable Growers Association. There was a booklet that was produced with a QR code to the videos as well as the paper copies. And this was actually distributed at the airport as workers were arriving as part of a vaccination clinic that was actually run at the airport. So we were happy that reach of these resources actually was pretty solid in terms of the airport and upon arrival. In terms of us, we got really focused on vaccine information. So we collaborated at the time. There was a lot of collaboration happening to look at vaccine information for newcomer and refugee communities And with these great partners here, OCASI, Refugee 613, already recognizing that vaccine information was not being organized in a way that was accessible to a lot of communities. So we were welcomed into this kind of collaborative circle of these agencies, and we ourselves adapted some materials to, based on their information to agricultural workers. So we did a video and this handout here, as well as a myth busting and facts video and handout as well around vaccines, as well as vaccination aftercare. So there was a lot of concern among workers around what would happen if they encountered some negative side effects, or so it seems to knowing what to do or what was in place after vaccination to try to address that was important to them. So that this became an important resource, and these they were great, and really quickly better resources came out after ours, but we really were a little bit ahead, so that when those better resources came out, at least there was a foundation from ours that had been starting the conversation. So we ended up collaborating a lot with a lot of public health units. So this is from the Windsor Essex Health Unit that really got really innovative, started really talking about so they did a walkthrough video to show sharing across with workers on what it would look like the day of vaccination, to really try to address any worry that workers might have from this experience that was just such a new experience for all of us, right? But for them as well. A lot of social media usage, collaboration among community groups to really share this information around vaccines. And I'll just finish really quickly, but a lot of collaboration with WSIB. So again, based on the focus that we identified that workers had not received information, with the collaboration with WSIB, we put together 2 videos in English and Spanish around key information around WSIB coverage during the pandemic. Still requiring a bit of a distribution strategy and more attention to identifying who can assist with workers, who could assist workers with claims. But WSIB definitely was so busy during this time and really worked very attentively to these communities. We also put on a webinar with WSIB and shared kind of key information with stakeholders, so community groups, so they were aware of the process, how they could support workers, as well as with other stakeholders. So this was a webinar we put on in collaboration with WSIB. And just quickly, so the whole empowerment or the worker OHS rights and responsibilities, this really was leveraged through another grant that we got through federal funding through Kairos Canada, a project titled Empowering Temporary Foreign Workers During COVID-19. So through this funding, we were able to put on a webinar talking about worker rights and responsibilities, employer responsibilities at the workplace, to key stakeholders as well, to really try to get those conversations going, and the importance of working together and having workers confident in what to do if they face reprisals as well, which was a concern. And we put together these worker cards, so focusing on the right to refuse unsafe work, the right to know, the right to participate, as well as WSIB in these colorful cards. And we ended up, and as things got better, I guess in September and October, and there was an opportunity to engage in person with some of these communities safely in these outdoor events, we managed to print some of these cards, put them into these bags, and distribute them en masse to workers to try to really promote awareness about their rights as well. And I'll share my PowerPoint in the future, but yes.
Yes, we will definitely post it. And anybody want to throw out a question for Eduardo? You'll see a link in the chat for the survey for joining us today. And I want to thank you, Eduardo. And hopefully, I was hoping like if something came up in the chat, you could write back just to catch a bit of time. So we're so happy to have you. And we hope you saw through the excellent speakers that we had today how very important collaboration is with occupational illness and disease prevention. We're so happy to have had you through and if you have not attended all of the sessions, please do go back. And since October 29th, we've been meeting on Fridays, 5 Fridays, with various themes, which you'll see threaded throughout the OC illness prevention program. And I really just wanted to thank you for supporting us. and we need you. So I guess the last call is that we need you to help us build partnerships and collect research and data, and to work with your workplaces and workers, and put occupational illness prevention on your objectives with your joint health and safety committees, whether it be infectious and acute disease like COVID, or any biological hazards, or longer latency, of which the Oc Disease Illness Plan will focus on. Sign up for the Silica tool if you're a construction company. Please go back and see the videos and share. And thank you, Eduardo, for joining us as speaker, as well as Paul and Shirley and Nancy. And we just really appreciate your time, and sorry for taking it up a little long today. So please do complete this survey. Go back and look at the videos, check out the presentations, share them with committees and health and safety reps, and thank you so much for joining us throughout the series. Oh, and I did want to let you know we are, Val and Kevin have been cooking up a December 10th session along with John to go through a workshop. John spoke about our ventilation tool that he's been working on, and Daryl was asking, saying that was one of his most significant hazards in the workplace, that goes to illness prevention, no matter what the contaminant. And if you check it out in our last newsletter and on our website, December 10th, we'll be holding an COVID session, and they're still putting together that program with a workshop on ventilation in the morning. So we look forward to seeing you all then. Have a wonderful afternoon, everyone, and thank you for helping us with occupational illness prevention in the province of Ontario. Cheers.